We live in an age of information, where we can access knowledge about almost anything with just a few clicks. Yet, this access to information has created a new problem: the growing discomfort of self-diagnosing symptoms and signs related to disease and infections. When we experience unusual symptoms, it's tempting to turn to the internet or ask ChatGPT for answers. We search for possible illnesses that match our symptoms, read personal anecdotes, and scour online forums. This process, however, can be fraught with uncertainty and anxiety. The internet is a powerful tool, but it cannot replace the expertise of a doctor who has been trained in medical schools and hospitals for more than 10 years. Self-diagnosis, diagnosis, and treatment offered by a nurse or chemist using a protocol leads to unnecessary worry and incorrect treatment. It can also delay seeking timely and appropriate medical care, resulting in complications and even death. According to a study published in medical journals, diagnostic errors committed by primary care professionals are now the third cause of death.
Healthcare systems around the world continue to inflict fear to increase demand, accept vaccinations to hoard wealth. Increasing demand has escalated the cost of care, but the quality of care has dropped in primary care. Medical errors in diagnosis and treatment has become the major cause of death all over the world. Encouraging consultations, performing tests, and treatment that are not necessary has increased cost, delay in diagnosis, and even death. 94% of families of hospitalized patients in India are bankrupted, and this is unethical. And my mission is to stop social inequalities in health that has brought us shame. This not only puts a strain on healthcare resources, but also poses risks to patients' health.
The human body is complex, and symptoms can manifest in countless ways. What seems like a minor issue could be a sign of a serious underlying condition. In 1996, I published a letter in BMJ criticizing using the pre-printed assessment sheet. I said, "Every person who seeks medical attention tells a story of illness as they have lived, experienced, and remembered, and so it continuously varies. The allure of self-diagnosis is understandable. We want to understand what's happening to our bodies, and we want to be in control of our health. However, self-diagnosis can be misleading and potentially harmful if you seek help from friends, family, or non-medically trained individuals. Recognizing that common medical illness diagnosis is a complex process involving symptoms and signs is essential. Physical examination and often additional tests are used to confirm the clinical diagnosis and cannot be used as a sole method to diagnose any illness. This process takes time and expertise to interpret, and more than 20% to 30% of these results are false, positive, or negative. This can be psychologically traumatic. They live in fear and so suffer throughout their life. While the internet can provide some information about a single symptom, it does not offer advice based on the combination of symptoms like doctors do, so it cannot replicate the nuanced understanding of a medical professional. The uncertainty of self-diagnosis using algorithms that can lead to a cycle of anxiety and fear motivated us to develop tools called Maya.
If a symptom show is red, it means you should speak to a doctor. And you must consult a doctor if 2 symptoms are red. If all the symptoms are red, you must go to hospital and not waste time thinking. Green allows you to speak to a nurse and not a doctor. And yellow connect you to the local chemist who will offer advice and treatment. If the symptom is blue, you may be infectious, and so advise the user to isolate to protect family and advice to not to rush to hospital or clinic. The app will also tag user and alert infectious disease controller if there are clusters of infected people in one areas and help them impose quarantine. So, Maya helps users understand the urgency of their symptoms, identify infected individual, prevent epidemics and pandemics. Maya doesn't just stop at giving you a color-coded result, but link to short videos and links to CDC websites with information to educate the user. The explainer videos define, list possible causes, and advice to speak to a chemist, nurse, doctor, or rush to hospital only if necessary. It's clear that Maya fills a crucial gap in healthcare.
It's crucial to help empower fellow humans to make informed decisions and reduce wasted consultation and cost to prevent cross-infections that will soon result in epidemics and pandemics. Please scan the QR code to download the Dr. Maya app, register, identify infected individuals, and isolate them at home. Symptoms are the body signaling that something is wrong. The symptoms can be physical or psychological. They are like warning lights on a car's dashboard. However, deciphering these signals can be challenging. Symptoms are what you feel and experience, and so can be vague, overlapping, and easily misinterpreted. What might seem like a simple headache could be caused by various factors, ranging from stress to dehydration to a more serious medical condition. The abundance of medical information online can exacerbate the problem. People tend to read small print and assume they have an illness or disease. Searching for symptoms online often leads to a long list of possible diagnoses, many of which are unlikely, but can trigger anxiety and fear. This can create a sense of overwhelming uncertainty because the driver of thought spirals out of control, diving deep into an emotional black hole, resulting in fear. It's easy to fall into the trap of worst-case scenario thinking, leading to unnecessary stress and panic. The human body is not a machine with easily identifiable parts. Illness is not always a fixed reality with clear-cut answers. Symptoms can be subjective and vary significantly from person to person. The same illness can manifest differently in different individuals. This complexity makes self-diagnosis unreliable and potentially dangerous if you seek help from non-medically trained doctors. Misinformation online further complicates the matter, causing delays in diagnosis and devastating complications, sepsis, and even death. Not all sources of medical information are created equal. Some websites prioritize sensationalism over accuracy. Others promote unproven or even harmful treatments. Being critical of online information and relying on reputable sources is essential. Understanding the threat of antimicrobial resistance is crucial for everyone, especially healthcare workers. Stay vigilant, stay informed, and prioritize your health and safety.